All right, so today we're going to be performing trach suctioning. So we want to perform hand hygiene, gather all of our equipment, identify the patient by 2 identifiers, ask them their name, date of birth, explain the procedure to the patient, and make sure that they consent to the procedure. You want to go ahead and make sure that your suctioning it's on and plugged in to less than 150 and between 80 and 120. And check the negative pressure. Pressure is on. You want to go ahead and put your sterile water into the container. And go ahead and open your package for your trach suctioning kit. Go ahead and apply your sterile gloves. Technical difficulties, y'all. Alright. So you're going to grab it with your dominant hand and wrap it around your hand. And then plug it into the wall suctioning. So this hand is now non-sterile. And you're going to go ahead and shake it. And suction is working. You want to hyperventilate, hyper-oxygenate your patient before you suction, and make sure their O2 stats are good. So you want to go ahead and suction it. Do not suction as you're going down. Put it in until you meet resistance. Suction as you're coming out and swirling around. And then get rid of the secretions and just wrap it around your hand once you're done and unplug it, throw it away. Now we're going to perform trach care. We've explained the procedure to the patient consents to it. We've gathered all of our supplies and laid them out. So next thing we're going to do is remove the dirty dressing from the patient and dispose of it. And then we want to take out the inner cannula, unscrew it, and put it into our sterile container and remove our gloves and perform hand hygiene. Right. Next thing you want to do is put on your sterile gloves. Go ahead and grab the inner cannula, that way you can start cleaning it. Grab the brush and just start cleaning it. Make sure you get every aspect, the inner aspect and the outer aspect, and just brush it and dispose of it. Next thing is you want to dry it. Of that. You want to go ahead and put it on your patient and lock it in place. Next thing we're going to do is clean the outer aspect of the stoma. Make sure you grab Q-tips. Oh well, they're not Q-tips, but you know what I mean. Dispose of it. Grab another one and clean it. Alright, dispose of that. Grab your sterile gauze and pat it dry. Dispose of that. Grab your new sterile dressing and put it on your patient. Next thing you will want to do is put on the new sterile straps on your patient and then take off the old ones after the new one is in place. Next thing you want to do is dispose of all your stuff and then put your patient in a comfortable position, call out when they're enraged, and perform hand hygiene.